लॉगिन करता हूँ. आई थिंक शहबाज के लॉगिन आईडी से कर लेते हैं. ठीक है. All right, so I've logged in from a social worker's account, Shehbaz. Right. I'll just go and open this form. I'll open a new contact. Right. So you see, so there is no other option. The new contact for the patient has already is opened. Depending on the different account, you might see different options for patient as well as grant for donor or etc. But for social worker, there is only one option for patient. All right. So this is the form. I'll be just going through some random things. I will not be saving it. This is for you to see. The 2 phone numbers are mandatory. Okay. And I am also going to make this a mandatory Aadhaar card. So the Aadhaar card of the child is the one which we require. Right. If the child doesn't have an Aadhaar card, either of the father or mother's Aadhaar card would do. If no Aadhaar card is available, there are other options: BPL, voter ID, driving license, or even a passport, because we do support patients from other countries. Right. So you can also type the passport number of the father in this here. The first thing which we want you to enter is the Aadhaar card of the child. Okay. So we don't have a field for the age. Yes. Sorry.
Ankit, when we say that drop-down menu says self, means the child, right?
Child, right.
So that is just, I just wanted to make it clear that self means child, right?
Self means child.
Thank you.
Okay. Then father's and mother's name. Then there is also a birth date. So by giving a birth date, the age will be calculated by itself. You have to also provide the gender of the child, the person who has filled the PIS, who sat down with the family, explained all the offers or activities by the candidates, and they filled the form by explaining the patient. That's the person we are looking for in this field. Right. You might not be the person, you might be the person who is entering the form, but the person who has sat down with the family, we want the name of that person. Okay. So this is a lookup field. So when you see an icon here in this search icon, so this is a lookup field. This means the name, you cannot type any name and save it. You have to select a name from here. Right. If the name is available, then only you can save it. These are the fields which are applicable for only when the patient has enrolled for a KCK and they have got a KCK membership number. All right. So the type of family, these are the very generic fields. I need not explain it in detail.
Ankit?
Yes.
Shall I ask question just now, or should we wait for you to finish and then we can ask?
So you can ask questions related to what I've covered so far.
Yes, that is the thing because you have just mentioned about the KCK membership.
Yes.
So can you please go to that field? So you have mentioned the KCK membership date. If that child is the member have obtained the membership, then only it will be filled, right?
Yes. Yes, that's right.
And suppose the child is 11 years old just now, and the criteria of being a KCK member says that any survivor who is 13 plus can obtain the membership of KCK group. So after 2 years, how we are going to update this?
So sir, the process will be explained by your team or Sitara, somebody, that how one patient can be enrolled as a KCK member.
No,
Uh,
I'm just giving a situation to you. Suppose
so,
XYZ is 11 years old.
uh,
So he or she will be eligible to be the member of KCK group after 2 years.
so the person will have to, the social worker or the person can contact the PNFP department that they want to get enrolled in KCK,
Hmm.
and the person who is responsible, I'm not actually sure who the person is, but
Hmm.
that person will register that KCK, that child, and will provide KCK membership number and enrollment date in vCAN.
So suppose Sitara is the person. For
Mhm.
instance, Sitara is
Okay.
the program manager of assistant manager of this KCK group, and
Mhm.
if she wants to update that data, so she can update it
Mhm.
through the CKID only.
Yes.
If she enters the CKID, she'll get the detail and she can update over here.
Right.
Is this the process? That is what
Yes.
I'm
Yes.
keen to know.
Yes, sir. So
Okay.
when these two fields are entered
Hmm.
for by from Salesforce perspective, that patient is enrolled in KCK.
Fair enough. Thank
Okay. Let me get back to other information. So these are all related to the personal details of the patient. These are related to the family, how many numbers of family, how many number of siblings, including the child. Okay, let me write it. And what is the family circumstances? So for example, the father has died, or the father is in very bad condition, or the family is facing some crisis, there are some other diseases or some other problems in the family. You have to mention it here. All right. Family income is in currency field. You can only write the amount they are getting per month. Total family income, um, number of total family members who are earning. So these are very generic fields related to the social worker. Every social worker, I think, know how to fill these fields and how to ask these questions. I'm not going to go into that detail. So this is related to father's qualification. If somebody needs clarification on these fields, you can write in We Can Help Desk group. Somebody or me we can explain it, right? If you get a special a person who is working on something which is not, he doesn't understand, the social worker doesn't get which category this person should be put into, you can ask in the group. We Somebody from our team or somebody from within the group can help you categorize that father's qualification or father's occupation.
And
All right.
Ankit, if I'm not wrong, all these information is being covered under the PIS form, right?
Yes. So
Right?
I'll also get back to the, I'll just explain the PIS paper form also after this. Let
Okay.
me, let me explain this also. So these are the documentations. These are the documents which we require from the patient, right? And um, if somebody has not provided, you can leave it blank. Uh, in the Lightning version, you can search the address, right? For an example, right? Okay. Otherwise, there's everything is pretty straightforward. You have to write city and state here. The state you have to select from this drop down. All right. I have also, if the country is not in India, it's some other state, for example, Afghanistan. This mailing state has no need not to be entered. Um, so by default, this is giving the home address the person is living from last 5 years. If they are temporary, they have an alternative address. You can write here. For an example, they have come to Delhi at some specific address for some relative. You can write here. Or if they have come to some other state at a particular address, you can write here. There are two fields for address, alternative address. Anything exceptional which has not been covered related to personal information of the family, you have a field called description. You can write here. So there are two open fields, description and as well as family circumstances. We have two open fields. So this field we are discussing to update. So this is something which we want to understand and analyze. So for example, we also want to analyze how many patients we are getting referred from from other social workers, other hospital social workers or ANMs or some nurses or doctors. So we want to analyze this field. For now, you can write the doctor has referred it, but we are going to make it a drop down so that we can analyze it properly. All right. Okay. So this is the contact form or the PIS form, what we call it, patient information sheet. So this is related to the personal details of the family because it includes all the phone numbers and fathers and mothers' name, right? So you can also see there is a consent taken stamp here. You have to, it's mandatory for every child, you have to take consent. We are going to make some changes in future, but till those future changes come, you have to take consent on the paper form which is given to you by your regional managers. There's a stamp available with everyone, all the social workers. If somebody doesn't have a stamp, consent stamp, please let us know, write in the group so that the consent stamp can be provided to you. Every social worker should have a consent stamp. If you don't have a paper form on which you have entered the details of the, let me unshare my screen first. Okay, so there is a paper form, a template form available, in which you can fill the form offline and later on go to the vCAN and enter all the details on vCAN. If you don't have that form, you can enter details directly on vCAN, take a printout and then take the consent stamp on the printout. But the consent is mandatory for all the patients and all the families. Please don't miss that. That's an audit item for all the regional managers. If they go and check the units, they have to check files, they have to check these PIS, patient information sheet, and check that the social worker is taking consent of each and every patient. All right.
Consent for what?
Consent for the information that they have shared with CAN-KIDS, that you have to explain to the patient that all the information which is being captured about your disease, about your personal information will not be shared with third party. It's for the best decision for CAN-KIDS to take on your behalf. For that information will not be abused in any way. Yeah. It will not be abused in any way. Right. So there is a specific wording on the consent stamp. You can read it and you can explain it to the patient. All right. So far, so good. Okay. I'll share my screen again. Then you click on save. When you click on save, this is very important. I will not be clicking on save, otherwise I'll be recording me as a patient. I will not do that. I'll just open one patient record and for you to show. Okay. So when you click on save, you will see this form, all the information which is entered. And you can also see this Google has all, because there's an integration with Google, the map is also showing the way that this patient is, so that we can also do lots of analysis and visualization later on Salesforce or on vCAN. The patient registration is not yet complete. You have to go to the second related tab. Okay, if you are using the Lightning version, you have to click on related tab. If you are using the classic version, let me also go to the classic version. So this is the classic version. You can see the detail of the patient here, and there's a sections available on the bottom of this form. There's a patient register page. Okay, let me get back to the Lightning version because I want all of you to use Lightning versions. That's why I'm explaining everything on the Lightning version. Okay, if you want to switch between, that's also very important. If you want to switch between classic and Lightning version, you have to click on this top right corner and click on switch to classic version. You will be getting on the classic version, and if you want to switch back to the Lightning version, the updated version, which I will be making it mandatory for all the social workers and everybody to use Lightning version, you can click here on this section, right? And you will get back to this Lightning version. All right, I'll get back to the patient registration part. When you fill the patient information first form of the patient, that in the related tab, this section will be empty. All right, so there will be no CKID. When you click on new and fill this form, then only you will have a proper CKID generated for this patient. The first form is only the half step of patient registration. It is not the complete step. For the complete patient registration, you have to click on patient register, new patient register. Otherwise, patient registration process is not complete. You have to fill this form for a patient to make complete patient registration of CAN-kits. All right. So this is the blank form. I'll just show it again where you have to click. You have to click in the patient register section, click on new for this patient and fill this form. All right. So this is the second part of the patient registration. So when the patient was enrolled, so today's date, right? You can click on this calendar icon, click on today. You can change it according to this format. Treating doctor. I'll just write something random for now. So you should know your hospital abbreviation. If you don't know your hospital abbreviation, you can ask me or in the group. We can help this. Also, if somebody isn't already on vCAN help desk group, just let me know so that I can add that person. So we have a WhatsApp group, vCAN help desk. Just let me know if you are not on that group. You will require that group to ask questions. You will require that group to raise any problem or any issues related to vCAN. All right. Okay. So for an example, I'll just write AIMP AIMS Patna, I think. AIMS Patna. So you can also search for your hospital. So there's a remarks column. It's related to what's the condition of the family or the treatment actually. So for an example, third chemo is going on. You can write here as on 10th October 2020. So this is a text field, open text field, which you can write anything. This is generally required related to treatment of the patient. What's the condition of the treatment of that patient? We have already written about the personal details and family circumstances in the first form. This form is related to the only hospital details. You have to write only the hospital details of this patient or the treatment details related to the patient on this page, on this form. This is the hospital number. I think that would be given on the OPD card. What's the treatment plan, right? For example, how many chemos are left, if there's a plan for the surgery, if there is some plan for radiation, we want you to write here in this space. So which department you are working in. Most of you will be already working in pediatric oncology, but in some hospitals we do work in other departments, and we do register patients from other departments. For example, if in my hospital I am working in pediatric oncology, but there is a new patient in ophthalmology or radiation which is not getting treatment by my doctor, I can still register a patient from other department. All right. So this is a drop down available for that purpose. So this field is now is not usable. I should be deleting this field. I'll not explain it. I'll just move on. So this is for reference number for the patients. In some hospital, if they have 2 hospital numbers, they use this field to write both of the hospital numbers and search for the patient. Okay. If the surgery is done or not done. Right. So these are the fields related to the treatment. If the flow cytometry or cytogenetics has been done, if the patient has metastasized or not. All right. So this is the protocol section. I think you by now, or for the new social workers, they should know what the protocol is. So there is a plan for treatment. There are certain protocols, named protocols available for every cancer treatment, every type of cancer. For example, for ALL, there is BFM, ICICL. There are other form of protocols available. You have to know and learn those protocol names, and because that will be asked in MSIM, weekly medical committee meetings. I think everybody has attended one of those. Doctor asks this question: which protocol patient is on for a particular type of cancer. For cancer, different types of cancer. So this is a field for cancer types and subtypes. There are more than 50 types of cancer for children. I will not be making you learn all those subtypes and types. So there is an Excel sheet available. I'll tell you in few minutes where that Excel sheet is. From that, you can search which category your patient cancer category your patient belongs to. That Excel sheet would help you to do that. Otherwise, you can ask your doctor or in the WhatsApp group how to categorize your patient into a specific cancer type or subtype. Okay, so there is some question in the chat. 1 second. Okay. Shamlali, I'll just get back to that after this. So there is a question related to consent. I'll get back to that after this form. 1 second. Okay. So the cancer site is applicable for some solid cancers. Solid cancer, for example, retinoblastoma, you have to specify that if the cancer is unilateral or bilateral, right? Or in the right eye, or which eye it is. If there is bone cancer, you have to specify which bone, right? So this is the field for the cancer site. All right. This is very technical details. I'll be skipping on to chemo. Right. For ALL, if you have written, there's an important field. You have to write highest WBC count before the treatment started. It will help medical committee meeting to make right decision. Right. If the CNS was positive or not. In case of a solid tumor, these are the important fields. If there is a plan for neoadjuvant chemo, or is there a plan for radiotherapy? All right. Okay. The next section, follow-up section. When you are registering a patient, you have to write on treatment. You have to write which date the patient has came on treatment. For an example, you had might registering patient on today, but the patient treatment started a week before. For an example, first you can specify it here, and then you have last seen that patient. You might have seen that patient today or talked to that patient today. So we know that this patient was alive on this date. All right. Clear so far? I'll be explaining it further in few minutes. There are lots of things to be covered. I'll be explaining it further, the follow-up section. For now, I'm just going to show how to register a patient. So this is the reference section. I'll also explain it when I explain about the different treatment status of the patient, so when we keep on following up with the patient. All right. So this is also related to different treatment stages. I'll also explain it later. So this is a question which is usually asked in MCM. What's the estimate cost of treatment? Right. For different hospitals, and for different type of cancers, there's an estimate given by the hospital. If it's not given by the hospital or by your doctor, you should know what estimate cost of the treatment for your hospital for that particular cancer is. All right. If you don't know, by experience, you will get that information. You can also take help from medical department. They might also help you in estimating the cost of the treatment. All right. So this is the section which is related to the education. So this is usually asked by the education team when they provide scholarship to the patients. All right. When you click on save, all the information details related to the family will be saved. I'll just show you this example. So this is a completed form, patient information sheet completed for the patient. Right. So you see that the chemo has not been started on this date. Right. Bone marrow report is yet to come. Right. Medical oncology department article. I was explaining there's a different protocol for different cancers, different ALL. So there's a B cell and A cell ALL cancer side. There's different types of ALL. So that's why this field is also being used for. They might not have the information about the highest WBC count, so they have written 0. So that's acceptable given but in MCM, you might ask why it was not taken, but you can click on 0 and save the form, right? So this is summary which is calculated by itself. You don't have to worry about it. All right. Okay. So this is the complete process of patient registration. I'll clarify the consent question, but other than that, if you have any questions related to these two forms, you can ask now.
Sir, I would like to ask that how would I know that about my last contact with the patient if I have not written it somewhere? Where the form we are filling, save last contact, and we fill it there, right? So
Right.
if I don't remember, the patient might have come 2 months ago. So how
this
do I
is
get to know?
so Divya, this process which I explained is the process of patient registration. I'll
Okay.
get back to follow up, how follow up is taken and how what are the challenges. So we'll
Okay.
discuss it in few minutes.
Okay, sir. Okay, sir.
So in this sheet, to answer the question of Divya, Ankit, correct me if I'm wrong. In this sheet, when we are registering, the day we are registering the patient, that is the last contact date that we are
Yes,
going to mention over there,
right. For registration
right?
purpose, that's the date we have to enter in last contact date.
Right.
That's a
Right.
mandatory field. You have to enter it for patient registration.
Yes. I hope this addresses your query, Divya.
No, so I'll answer Divya's query. That was different.
Definitely follow. You are going to explain in any ways. So for this
Yeah.
form information that you
Because
have.
that's what I got confused with, that if we are registering it, then how do I fill the last contact of the patient? So that made me a little confused. The
Yeah.
follow-up is a different thing. That's why I wanted to ask about the question.
Surely,
Thank you
surely.
for addressing it, sir.
Okay.
अंकित जी,
हाँ जी,
तन्मय फ्रॉम कोलकाता।
हाँ तन्मय जी नमस्कार, बताइए।
हाँ हाँ, सुनिए ना, वो समटाइम्स हमने जब कोई पेशेंट को एक्सपायर्ड हो जाते हैं तो उसको अपडेट करते हैं उसमें, लेकिन जब वो फॉलो अप नोटिफिकेशन आता है ना, उसमें एक्सपायर्ड पेशेंट का भी फॉलो अप नोटिफिकेशन आता है, उसके लिए क्या करूँगा?
So Tanmoy, you are asking a question related to the follow-up. I'll be explaining it in just in the next section. I'll be explaining it, all the treatment status, how to do follow-up, and how to manage that information. Just just wait for a few minutes. I'll be getting back to that part. Okay.
ओके।
Mm, all right. Anything related to patient registration, any field, any clarification you need for any field, right? Who was the new joinee, other new joinee from Punjab? बलबीर जी, बलबीर हैं?
बलबीर, जेसिका, शिल्पा, दिव्या. Divya
अच्छा,
has already asked the
हाँ
question.
दिव्या ने तो मेरे को सब
हाँ.
लग रहा है कि समझ में आ रहा है. शिल्पा,
Yes, sir.
शिल्पा जी हैं? हाँ, शिल्पा जी,
Yes.
you are getting all the everything, right?
Yes, sir.
No, any questions related to any field?
No, sir. कोई क्वेश्चन नहीं है सर.
आप ध्यान दीजिएगा, अगर कोई क्वेश्चन कोई हो, फॉर्म फिल
हाँ
करते
जी.
हुए आपने कोई फॉर्म फिल किया है अभी तक?
नहीं सर, अभी तक कोई प्रोफाइल नहीं शेयर किया.
अच्छा, कोई अगर फॉर्म फिल कर रहा है और कोई क्वेश्चन है, you can ask him. Okay, let me get back to that question which Shyam sir has asked. Right, Shyam sir has asked, if we have taken consent, can we use a picture of the child for any specific purpose? Can we go ahead and take a fresh consent? Please clarify it. Thanks.
Shilpa,
All
please
right.
mute yourself.
Shilpa, please mute yourself. I'll be explaining this answer. For consent process, let me share my screen again. Okay. We do take two pictures. Shilpa, please mute yourself again. I'm sorry. I'll just get back to the first form of the patient. I'll click on the name of the patient on CKID and I'll be going to the first form. So this is the first form.
Okay, sir.
Right? So we do have to take two pictures of the patient as an ID proof. And
Okay.
you can see there is an option of uploading a picture. See, there is an option by which we can upload a picture of the patient. So uploading a picture on this page on vCAN is required. It's not mandatory, but it's required. You can I can upload, for example, let me upload my picture. Let's upload this one, right, and I click on here. I have uploaded my picture here, but I can also delete it. So there is an option to upload your picture, and it's required by CANKID, right? You have to upload picture, but the consent process, the consent form, the consent wording only cover as much. It covers only a scope. It has a limited scope. You cannot share this with anybody else. You cannot share this form with any other person outside CANKID. Please be mindful. You cannot share any information related to the patient outside CANKID. Right. This patient information only belongs to the patient first of all, and then CANKID. All right. So you cannot share it with anybody else. For sharing it for any other purpose, for putting up for an event, for using a picture for anything else, there's a separate consent. There's a separate clauses. You have to take that consent form from SEPA department. All right. For using a picture, for using a patient information for any other purpose other than patient registration and follow-up and this thing, CANKID activities, for any event, for using a picture for any other purpose, for sharing details, you have to take a different consent. Okay, so that form is available with SEPA department. I think I've clarified the question which was asked by Shyam sir. All right.
Shilpa ma'am, could you please mute yourself? It's causing a lot of disturbance.
Sure.
My next agenda was multiple hospital registration. Okay, I'll be getting back to this. This is the fourth item, follow-up process, which the questions I was getting for. I'll be getting back in few minutes, but let me explain the multiple hospital and shared care in patients. Okay.
अंकित,
Yes.
अंकित सॉरी, जो दिल्ली के सोशल वर्कर्स हैं,
हाँ.
दिल्ली के जो सोशल वर्कर्स हैं नॉर्थ के, उनका एमसीएम स्टार्ट हो गया है, तो जिनका प्रेजेंटेशन है प्लीज आप लोग एमसीएम ज्वाइन करें इमीडिएटली.
हाँ जी, प्लीज.
ठीक है, यू मे लीव. जैसे अगर बुलबुल थी, वो मैं देख सकता था. प्रताप हो क्या आप यहाँ पे? नहीं, ओम प्रकाश हैं. ओम प्रकाश, प्रताप, प्लीज आप लोग देखो, जिसका केस प्रेजेंटेशन एमसीएम में, आप लोग प्लीज एमसीएम में वेट हो रहा है आपका, जाइए. थैंक यू. प्लीज कैरी ऑन अंकित.
So this, I'll explain it again. So this workshop, this session is for all the new joinees. Other people are mostly welcome, but please do attend your MCM or other activities. That's your priority. I'll be recording this. I'll be recording the whole session, and I'll be putting it on YouTube link. I'll be sharing it on group so that later on anybody can go and see it. Okay. The next item was the multiple hospital registration or shared care. For an example, a patient who from a GTB hospital, as I'm just showing you this as an example, this patient was referred from GTB hospital to Max hospital, or the patient might be getting treatment from 2 hospitals or more than 2 hospitals. So in that case, the first form, the contact form of the patient will remain the common form because that involves the patient personal information. Sorry?
I can't see your screen.
Oh, I'm sorry. I forgot to share my screen. Thanks for reminding me. All right. I was showing you as an example. For example, you are working in GTB hospital. All right. We have created this part. This CKID belongs to a particular hospital. So this CKID, any assistance which is being given to a patient is being given in a particular CKID and in particular hospital. Right. So this hospital or this CKID belongs to this hospital only. If a patient goes to a second hospital and, for example, for radiation, the social worker will have to create a second CKID or second hospital registration for that patient. For that, they will go to the contact form, and in contact form in related section. So this is when they click on detail, they will see the detail of the contact form. When they click on related section, they will see the CKID section. In this section, you will see that there is CKID associated with this hospital, and for the second hospital to be registered, you have to click on new and fill the form again for that second hospital. So this step is being taken care by the social worker of the second hospital. All right. So that's the process, how the process goes for multiple hospital registration. And in that second hospital, when they click and fill all the details, so they will get a second CKID for the same patient. I'll also explain what does this mean. The CKID is the hospital registration, and I'll also introduce you with a new concept called UCKID. So there's a field you can see here, UCKID. So this is the actual unique ID of a patient. I do not popularize it. I do not market it because this creates confusion. Okay, you have to use CKID only. I'm just showing it for your reference, for your better understanding. But always, when we talk about a patient, we always talk about CKID. I do not want to market UCKID. I only want to mark HCKID for a patient. Because
Ankit, I
otherwise
have a
it will
question
create
here.
confusion. Yes.
If I may ask, I have a question here. So when you say that there are going to be two IDs, hospital ID, so while the
Yes.
reports get generated, so
Yes.
the report is going to pick up the unique ID or the CKID. So sorry, let me just complete. So under the patient registration, so when
Yes.
we want to identify who the patient is, do we search through the UCKID or HCKID?
Ma'am, for all the hospital donor and social worker related activities, we only refer to HCKID, hospital CKID, because that's the final step of patient registration, and that's a complete step actually. UCKID is not a complete step. It's only for the when there is a requirement of multiple or shared care model. So we only use UCKID in the reference when we talk about patients who are on shared care. So social workers, while creating reports, while all the reports I have created are based on HCKID only.
So sorry, one more follow-up question. So does it mean the same child who has been treated at two different hospitals for different, verticals? So there, would it happen the child gets counted, say for at the social worker level, at hospital one, they are counting that this child is getting treated here, and at hospital two, the same child is going in. So which means the same child is reflecting in two social workers' data, right?
Yes, ma'am. So
Okay.
the answer, straightforward answer is yes. But in Salesforce, I can identify. And when I create a registration report of all the hospitals, that patient will be also shown in GTB hospital registration. That patient will also be counted in Max hospital registration. But when I create a total of that report, the total report will not count that patient two times. That will only count that patient one time. In the
Right.
portal.
Thank you. Thank you.
Okay.
Ankit,
Yes.
I also have a question related to this.
Sure.
So basically, since you have said the moment we go to the new tab that you have shown, we go to the new patient registration form again, right?
Yeah.
So since it is going to be referred from one hospital to another hospital, right? This is the case, right?
Yes.
For any sort of surgery or any particular vertical, I guess. So is there any specific field which says it is referred from where to where? Is there any specific field that we will be getting after going to the new tab? Because this is the case, right?
So there is a section for referral section, right? So this is filled only when a patient is referred from one hospital to another. All right. I do not want to fill it for this patient because otherwise it will change the record of this patient.
Right.
I do not have an example demonstrated. I'll just explain it and to my best possible way. And when we refer a patient from one hospital to another, there is a field called treatment status is referred. So that hospital is not responsible for when I click on save, this hospital will not be responsible for further follow-up of this patient. The follow-up for this patient will be responsible by the second hospital. So if I click here on referred, so this field becomes mandatory. You cannot save a form record.
This field is at which section?
Referred section.
Referred section of patient registration or what?
Patient registration.
Okay, so
second form, CKID form.
X number X child is registered with AIMS Patna, and now that child is being referred to KGMU. So once that child is being referred to KGMU, that the social worker at AIMS Patna has to fill up this field.
Yes, they have to click here, referred on this date.
Right. So that is what I'm making clarifying with you. If that child is being referred to KGMU, that the social worker at AIMS Patna must have to fill this field. So that child has been referred. and now the onus is on KGMU. Then KGMU
Right.
will register that child at their level.
And the further treatment related follow-up on any activity for that patient will be responsibility of the KGMU.
Okay, I'm just making it clear for my clarity and for.
Okay, Ankit ji, I have a question. Ankit,
हाँ जी, sure.
अंकित जी,
Who's asking?
मेरा क्वेश्चन है, अगर
बलबीर,
हमारे
हाँ
पास
जी.
patient है, we are referring the patient from Ludhiana to Chandigarh. Again in Chandigarh, we have to register the same patient. अगर ये थोड़े टाइम के लिए यहाँ पे सर्जरी के लिए आया, उसके बाद the patient is moving again to Ludhiana, तो वहाँ पे लुधियाना के अंदर जो हमारे सोशल वर्कर हैं, इसको 2 पेशेंट काउंट करेंगे या they will count only 1 patient?
So that patient for hospital-based registration will be counted twice, but in the final report for the Punjab, that patient will be counted only as one. So they can refer one patient from one hospital to another by clicking here and get back referral from the same process. They can also from Ludhiana to Chandigarh and Chandigarh to Ludhiana. They can do that. In that case, only 2 CKID of a patient will be generated.
Okay,
Sir,
fine,
also
fine.
I would like to understand one thing. Like for example, a patient was there in DMC Ludhiana, and the social worker there had filled the form and everything was done, but the patient got referred to PGI Chandigarh. So the form says that it is referred on this date to PGI MER, and the form closes, right? So when the patient is referred to PGI, we fill the form again, but will we be able to see the past history of the patient that happened, what all happened in DMC?
Yes, of course.
That would be good.
So I was actually in the middle of explaining it, but when you click on referred, so there are few things happening here. When you click on save, this field become mandatory. You have to enter the patient, which hospital that patient was referred to. For example, Hinduja. So Hinduja is not in our CAN-Kids CHSU partnership list, but this option is still available here because a patient gets referred to any hospital anywhere in India, right? Hinduja, when you click on search here, you might not find Hinduja in this list, right? So you cannot save a patient here as in Hinduja because that's not in CAN-Kids partnership list, but you can refer a patient to Hinduja hospital. So this is the one thing that's happening. So when you click on save, the referral date, the date which was referred, this will get copied here. So this you have to leave it blank until the second CKID is filled. When the second CKID is filled of that patient in the Hinduja hospital, the social worker can write the CKID of that Hinduja hospital registration here, and when they do that, these 2 CKID will be getting linked. There are lots of things happening. I'm still developing it further so that from the feedback of all the social workers and all the people who are using it, so that it becomes more easier and more automated by vCAN, and information gets shared both ways, from one social worker to another and other social worker to one. So the both CKID will have automated fields in which, for example, treatment status of the second CKID will keep on updating in this one. So if the patient will remain referred in this CKID, but in the second hospital, this field will keep on updating. The patient will complete his treatment. The patient might get relapse or expire. So this field will keep on updating by itself. So there are few things happening. I'll be explaining it further in other sessions. So this is something which I'm still working on. I think I've answered, or maybe I have not. Did I answer your question?
Hello.
Yeah, Joseph.
Sir, just want to confirm if, let's say, in Wadia Hospital we giving a facilitation like anything, like any facilitation, then it is referred to Goa, and even in Goa I'm giving the same facilitation like different kind of medicine or any kind of. So will it reflect on both the CKID?
No. So that facilitation or that assistance is specific to one hospital actually. We have a budget.
Okay.
We have a budget for one hospital and we have a budget for second hospital. So any expenditure we have made or any facilitation which was incurred on one hospital, one CKID will not be reflected on the other CKID.
Okay. Thank you, sir.
All right. Any other question related to hospital shared care model or multiple hospital registration? This is kind of a bit confusing. I'm still working on it. Yeah.
Ankit, the same patient will have two CKIDs, correct?
Yeah. Who?
So whenever we want to know about the details of that particular patient, so both the CKID we have to refer.
Give me an example. Which report you are talking about? If you are talking about a hospital report or report to a donor.
No, see, I am creating one CKID second time in our region. So already he's taken treatment in some other region. They don't know that they are having CKID there and they are having all the details there. If I want to get the patient's detail, then how I came to know that the patient is already having a CKID and that CKID is this.
So that's why, Shankar, I have created this field. 1 second. I'm still working on it. Right. Right. So when these two forms, when you enter the referred CKID, first hospital enters the CKID of the second hospital. Right. These two CKID will be linked, and I would know that this on this CKID, when I open this CKID form, I will know that this patient is already belong to a different. But this is the second hospital. I can show you the example, but actually, because I cannot save this, there's a field called hospital level. In the second hospital, it will be written as second hospital. In the third hospital, it will be written here as third hospital. So this CKID is the third CKID hospital.
So sorry to interrupt you. You can show an example of Nikita Yatnur. It is referred by 3 hospitals.
I didn't get the name properly. Sorry, can you repeat that?
Nikita, Nikita, Nikita Yatnur.
Yatnur. This one, na?
Yeah, yes, sir.
Okay, so this one has multiple hospital registration, 4 levels of hospital registration. Okay, so this hospital, so they have, so this is automated. There are some codes, custom codes here. So that's why it's calculated that this is a third or the third or fourth hospital or whatever. After third, the counting stops. I haven't created more than 3 levels. So that's why it's saying a third or more hospital. And in the second hospital, it will be shown as the second hospital. Okay. And if I'm correct, there is also a field here. How many registrations this patient has? There are 4 CKID available for this patient. All right. So these are the fields which are related to multiple hospital registration. I know there might be some gaps. You can also, based on your feedback and other people who are using shared care model, I am still updating it and making sure the right and correct information is entered. Okay. I think Aniket helped me for this patient, right? Thanks. Any question related to multiple hospital registration? Okay, but when you start working on it, you will have more questions. You can put up in group, WhatsApp group. You can ask those questions in the WhatsApp group. I might not cover all the topics which I've mentioned in my agenda. So I'll just focus on sharing. I'm running very late. So I'll be finishing on 1. I might have another session next week or so to cover other topics. I'll just go on and move to the next topic, which is the follow-up process. Okay. Right. I'll just show it in this example only. All right. Okay. This patient has completed the treatment, right? Okay. On this, so I'll just explain you how to read this. So this patient completed treatment on June 2020, 20th June 2020, and last date of contact was 9th October. This patient was last seen yesterday, right? And who has seen updated the information, Aniket Ghadi, right? So this is how you read the follow-up section. So this field, the status event date, is the field which is related to, which is connected to this treatment status and alive status. This means the status which we can see here belongs to which date. If the patient was on treatment, the patient was on treatment on this date. If the patient was referred, the patient was last referred on this date. When you keep on updating these fields, these two fields, alive status and treatment status and event status, these fields will keep on updating for the patient. Okay. So I can see the patient diagnosis date and treatment start date is not entered because this I have automated quite recently. Otherwise, for the old patient, from now on, these fields will keep on updating by itself. You don't have to enter every date in this section. These fields or these dates will fill automatically from these three fields, 1, 2, and 3. When the patient gets referred or patient gets relapsed, this section will be filled automatically. And we would know that a patient who has completed treatment was also relapsed on this date. A patient who has completed treatment was also had abandoned on this date. Right. And from this date, we will know the patient has relapsed on this date and then expired on this date. That's why this section has been created, and this section has been created quite recently. So this information is not available for older patients. It will be available from now on. And there is another section, patient register history. You can also see in this track, in this section, in this history section, what were the different stages. The patient was abandoned on this date, then he was referred, then he was, the last contact date was this, the contact patient was contacted on this date. These values or these patient history details will be keep on updating by itself because there is a history tracking features available on certain fields. This is not a good example to show, but I don't remember any particular CKID. I can show, maybe I can show older patient CKID who we are updating quite, because I'm not working with the patient directly, so that's why I don't remember the CKID of the patient. So the history, so the point is, when you keep on updating these 2 or 3 fields, this section will keep on updating, and when the patient completes the treatment, this section will be entered here. And we would know if there had this patient had any event, any relapse or any abandonment in the history before completing the treatment. Clear? Is this clear, right? I might be going a bit fast. You might have missed something. Divya asked a question related to the patient follow-up.
Yes, sir.
I think I've covered that, or maybe you were asking the same, the simple one. I've made it complicated. I don't know. I've tried to
No,
answer
sir,
it.
I have understood that. That's absolutely fine. I've understood what you have explained.
Okay.
So we can follow up. Yeah.
So the simple thing is for you to learn is you have to update, keep on updating these two sections, these two or three, this section actually, alive, on treatment, and the last contacted date. If you have seen a patient 2 months back, you can write the date of 2 months back. That's not an issue. And if you have talked to a person and if you know that this patient is alive and is on treatment or has contacted on this date, you can update this field. So this can be as frequent as you want. This is not mandatorily have to be entered every time you see a patient. I am working on a particular report, a particular mechanism, monitoring mechanism, in which at least once or 3 months you have to update this field. Otherwise, it will create prompts. It will create some notifications for you, for social workers, or for any person who is updating the fields related to a patient, to update and contact that patient again in at least once or 3 months. Okay. Another important thing. This I have also automated. I have linked it with this date, latest contact, latest assistance date. Where is it? Right. So I have also linked it with this field.
Sir,
When was
please
the?
share the screen.
Oh, I'm so
Screen,
sorry.
screen.
Sorry.
Can you share the screen, Ankit ji?
Thanks. Thanks. All right. Okay. So this is it. So this is the form I was talking about. Right, the automation I've done. So you need not update this field when you have provided assistance today. So when you have provided an assistance today, this field, latest date of assistance will get updated by itself, and from this field will be copied here also. So you need not enter or update this field when you have provided assistance, any type of assistance to a patient, right? It will automatically copied from the latest assistance date. So this is a section I was talking about. This is which is calculated by itself based on what assistance we are giving to a patient. This section is filled by the related assistance forms.
Sir,
These are the forms I'll be
one
explaining.
more thing. For example, in a year, PGI MER sees 450 to 500 patients. That's the actual number that I'm telling. So there are like 40 to 45 patients per month, those who are coming new. And I am mostly able to see like 30 patients to 35 patients. Please, thoda dheere. There are 30 to 35 patients, those who are those I'm able to see. Whenever I'm, for example, getting them registered, there will be a CKID generated, right? But when I have to find that patient on the follow-up, how would I find them? I'll find it with a CKID, correct? Or by a name.
Or?
Because, or by the name. Because remembering all the CKID would be very difficult for me. So how will I
thanks, Divya. Thanks for asking this question. That was a section which I missed. So that was my. Let me show my screen again. That was second agenda in my list which I've missed. If you can see my screen, so this was the agenda which I've missed. Okay. I'll get back to that. For an example, Shehbaz, this is the ID which I'm using of Shehbaz social worker. From patient register, you can click and see the recent contact, but this is mostly the one which you have opened. You don't remember each and every patient, that's for sure. If you if you see a patient today, for an example, if the patient came today, you don't remember his CKID. In Delhi and in some places, it's a practice that you provide a slip to a patient with the CKID, and by that slip, all the social workers know that they have this CKID or this registration number for this for CAN kids. So that's a different issue. Even they don't bring the slip, you can even search from their phone number. Right. So you can search from their phone number. You can also search from their hospital number. They might have an OPD card, right? For an example, and
So we have a POC number, so we need to register that POC number. That makes it easy for me to search that patient.
Right. So, for an example, this is the hospital number for this patient, 802-230. Right. I can also search from this on the top section. See, this gets by suggested to me in the search box itself. I can click here and open this patient CKID directly. So you not only from CKID search patients from the CKID, from their name or from their hospital number or their phone number. You can search from any of the fields which you have entered. For an example, you can also search from the father's name, from the mother's name, from phone numbers, from their Aadhaar card number, from their any number basically, or any name you have written. Other than that, there is more simpler way, which is by reports. Search is, I think, the best option, but other than that, there is a better option called this. In the report section, you will find your hospital baseline, and in that baseline, you will find all the patients you have registered. So that's basically for your hospital. And if you remember when the patient was registered, or you can click here and click on all time to see all of your patients. So 194 patients for this hospital has been registered, and I can click on search in this list, and I can search from this list. There is an Ankit. Okay. Right. So I can search from this list also. So this is the most reliable way of searching for a patient. If you know only the first name of the patient, and if you don't remember anything about that patient, you can go to your hospital baseline. I'll be covering about baseline and reports in later sections, in later agenda. But the baseline is the most safest way to search for a patient if you know only the first name of the patient. Okay. I've also missed an agenda which was the printout. How you can take printout. Om Prakash ji, हाँ जी.
एक्चुअली जो भी बेस फाइल आप दिखा रहे थे ना,
हाँ.
जब हम बेस फाइल हम लोग जब डाउनलोड करते हैं ना,
हाँ.
तो जो एक्सेल शीट में डेटा मतलब आते हैं, उसमें जो उसकी जो फॉर्मेटिंग होती है, सपोज करो एनरोलमेंट डेट की ना, तो हम उसको जब हम फिल्टर करते हैं उसमें मल्टीपल ऑप्शन आते हैं. जैसे होता है कि अगर जनवरी में जो बच्चा रजिस्टर्ड हुआ है तो जनवरी पे क्लिक करने पे सारे जनवरी के फाइंड हो जाना, आई थिंक फिल्टर हो जाना चाहिए. ठीक है, लेकिन क्या होता है कुछ तो जनवरी के कॉलम में होंगे, कुछ ऐसे जैसे लगता है कि हम मैनुअल अपने हाथ से उसमें डाल रखा हमने, और उसके हमारी एंट्री में कहीं प्रॉब्लम है या कहीं कुछ और
नहीं. ये दिस इज रिलेटेड टू दिस इशू इज रिलेटेड टू फॉर्मेटिंग ऑफ एक्सेल. So this is an Excel issue, not vCAN issue actually. I can explain it quite easily, Excel, but I think it will take some time, and I don't think everybody needs to learn it. You can search and go to YouTube and search for formatting date column. Just write on YouTube, formatting date column in Excel.
Right.
You will get that answer. Okay.
I know. मुझे पता है अंकित, जो आप बता रहे हो ना मालूम है, लेकिन जब हम उसमें डाउनलोड करते हैं ना तो जो उसकी फॉर्मेटिंग हमें अलग दिखती है.
नहीं, वो सेम इशू है, एक्सेल का इशू है वो, वीकेंड सेल्सफोर्स का इशू नहीं है.
ओके ओके, आई विल. थैंक यू.
ओके. Okay. I'll just go to the patient contact form again in the details section. So see, I have explained there is a process of patient registration which we covered. I forgot, I missed an agenda which was taking the printout of the patient. When you are taking a printout, there are two methods to do that. The generic way is just go to the CKID, click here, and there is an option for printable view. Right. When you click on printable view, you will get to see all the hospital related censored information about the patient Samya Singh. Right. You will see the CKID, you will see all the hospital related activities and what assistance was given to this patient, and all the assistance which was given to the patient will be entered in this section. This page might go to 12 pages based on number of activities or number of interventions which we have given to a patient. So that's why I encourage only to take printout of the CKID page. I can click on this print this page and take a printout. And this is how generally you should do it. Okay. To save the pages or select the pages which you want to print out. You need not print all the pages. But if you also want to print out the details of the patient contacts, phone number, etc., you have to go to the contact form and then click on printable view. Here it is. When you click here now, then you will only get to see the hospital summary of hospital registration and all the contact form of that patient. For a complete patient registration printout, you have to take printout of both forms, contact form as well as the CKID form. For any other purpose, for example, if somebody has asked for a printout for specific purpose, for example, for particular assistance or particular MCM, for an example, you have to take only printout of the CKID form. You need not take printout of the contact form of the patient. That's actually a confidential form. You shouldn't share it, and it's only for record keeping purpose. Okay. So that's how you can. There's a simple button available for taking printout layout of patient form. All right. Let me check if I've missed any agenda. Yeah, yes. Okay. Let me explain the assistance form also. I will not be covering everything which I've written on the agenda. I'll be moving some part of the agenda for the next session. I will not be able to cover everything today. Okay, let me explain the assistance request process. Assistance form. Okay. For assistance, you have to click on the CKID for the patient. This is where you enter all the assistance related details. Okay, so there is another section. Somebody saying something. CHMO. Okay. Thank you for muting yourself. So there is a section for notes and attachment also, which you can also use from your mobile phone. So I will also explain the mobile app of Salesforce. You can also download and install Salesforce app on your phone, and you can basically do all the activities which I have explained so far on your phone. You can also enter the assistance and any detail of a patient on your phone. You need not open your laptop and enter everything on your laptop. The user interface is quite similar. You can also search for a patient. By default, I think you will be opening a different page, but basically you can do everything which I've explained so far on your phone. For uploading any attachment, any OPD card or any related documents of a patient, you have to just click on upload file, and on your laptop you should have saved those documents, and you can upload it directly here. It's a good practice to name your documents properly so that you also identify if it's an OPD card, if it's a CT report or an MRI report, so that it becomes easier for the person who is opening those attachments and to check which attachment they want to open. All right. Should we go on, and should I explain the assistance form now, or do you want a 2-minute break? What's the consent? मेरे पे सर आप बताइए.
Please carry
everything
on.
is feasible.
I'm okay with it. I don't know about others. I'm perfectly fine.
बलबीर से भी पूछना पड़ेगा. बलबीर जी.
I don't have any problem.
Okay,
You can
thank
carry
you.
on. Yeah, please.
बांटो सर ज्ञान बांटो.
Okay, everybody can see my screen, right?
Yes, sir.
Okay, thank you. So there is a section called assistance section, or in the related tab of CKID. In the assistance section, this one assistance will be, oh sorry, it's not entered for this patient. Because this is in a very old patient. Let me open a quite recent patient. I think this seems to be relatively new. No, this won't do. Okay, right. When you register a patient, there is one assistance which is entered by itself, by the Salesforce, by the system itself, which is called YANA protocol. So this means you need not worry about it. This is entered by a code. This means that you have also provided financial counseling, and this is entered because there is calculated for calculating for a reporting purpose. It becomes easier for me to make report for assistance, for counting how many patients has got how many assistance, or how many patients have got no assistance at all. Right. So this is basically for the reporting purpose. You don't need to worry about it. So this basically means that a social worker, while registering the patient, has explained every aspect of patient register form, and they have also counseled the family related to the YANA, how they will be keeping up with the family treatment, or the treatment, how much money they are going to spend. So that counseling has been done, and we assume that it's being done for each and every patient. Okay. That's also actually, by the way, audit checklist for a regional manager. They have to also see how the patient are being registered, whether the right process is being followed up while registering the patient. They are taking the consent. They are explaining each and everything to the patient. The person who is explaining the form, they have done all the necessary steps, associated a patient navigator if there is a patient navigator available in that hospital.
If I may add, Ankit. So YANA is "You Are Not Alone" is the signature program of CAN Kids under the ENFA department, and this is being mostly being done by the patient navigator, who are our P3SG members also, most of the cases, and where your P3SG member are available, that is mandatory for them. First of all, they have to hold their hand, listen their story, share their first own experience to them. Then they can they feel comfortable to explain their own experience with the patient navigators. And by doing this, they provide emotional support. They counsel them. They provide them. They assure them that they are not alone. We all are with them in this journey of cancer treatment of their child. and that is the yana protocol that we used to follow, and that is mandatory for each and every patient, right, wherever that patient navigator is available. Otherwise social worker has to ensure that this is being done, right, Ankit?
Yeah, that's right. Thanks for explaining it. I've also skipped or might have not explained it this properly. So there is a field called Yana PhD member associated with family. Most of the cases, social worker might be the same person who is filling the form and who will be responsible for following up with the patient. But wherever there is a Yana PhD member available, we do encourage patient navigator, specific patient navigator, to be associated with the family itself. So they will, this will be the person who will be responsible for this family, right? That these two people can be different, and this can also be updated based on if a patient has moved to the different hospital. Okay. Okay. Where was I? On the assistant, sorry, I forgot. You can see my screen, right? Okay. Let me go back to this assistance. So there are three types of assistance: request, provided, requested, provided, and there is another assistance which is sanctioned, which is only entered by medical department and education department. Medical department enters it for MCM, and education department enters it for the scholarships. All right. So the
Yeah,
social worker.
I have a question over here, Ankit. Sorry.
Yeah.
So suppose if somebody has requested, somebody is receiving the assistance under SHSF, that is Survivor Helping Survivor Fund.
Okay.
Where are we going to enter that thing? Or under PHPF, Parent Helping Parent Fund. That is also a very essential, sort of service that we are providing.
I think the social workers and I think everybody doesn't know about this fund, what this fund is for, and why, when it should be applied for. I think you should explain it
Is
also.
it?
I don't think so. Everybody knows about this one.
I want to hear from the social workers, the older one especially. Is there anyone who doesn't know about these funds, or is there anyone who know about these funds? If I may ask, Om Prakash, you are the oldest one I can see. आपको मालूम है कि हमारे यहाँ पर PHPF और SHSF का फंड है, पता है या नहीं, ओम प्रकाश?
ये सर पता है सर मुझे।
किस लिए होता है ये फंड?
सॉरी,
ये फंड किस चीज के लिए, कब अप्लाई करते हैं इसको?
ये बेसिकली जो हमारे उसमें एचएच में जो बच्चे हैं ना, वो जो है फंड वहाँ से हमें कलेक्ट होता है, और वो आके अगर वहाँ पे जो बच्चे वो होता है एडमिट होते हैं या उनको जो जरूरत पड़ती है लाइक फाइनेंशियल सपोर्ट की, तो वो अमाउंट वहाँ से उनको मिल जाता है।
It's not limited to that, ओम प्रकाश. I think इसलिए शायद अंकित ने बोला कि सबको शायद पता नहीं है. Now I can understand. So I would conduct a session on PHPF and SHSF especially for all the social workers pan India.
Okay.
Although I do explain whenever I take any orientation session, at least for last 1.5 years till I'm here. So I guess जितने भी मैंने सेशंस लिए हैं ओरिएंटेशन वाले, सबको मैंने PHPF और SHSF जरूर एक्सप्लेन किया है. Recently I did with Punjab team. I think Jessica, Shilpa, Divya and Balbir must be aware, I guess.
Yes, sir. Yes, sir.
And in fact, I do share the reading materials as well with the policy and everything, so that they can refer in later on. But anyways, I'll conduct that. But still, I need to get the clarity on this part, Ankit. Where do they mention and how they do mention these assistants if we are providing some sort of PHPF and SSS?
Sir, one second. Let me show my screen. So I'll come to that. Let me explain the basics also, request and provided. So the request form, let me explain the request form, then I'll explain the PHPF also. So currently we are using request form for different purposes. So it's being used for these things, for diagnostics, for BMT and for committee in medical, and in PPOP. So in PPOP and PPCP, it's basically being used only in our Delhi CAN kits OPD. We are not using it for any other purpose. And for under TSP, the request form is being entered for only for convents and for HEH request.
Yes.
Okay. And request form is being monitored for education also, for scholarships. I haven't opened any other request form for any other fund or for any other assistance. If there is a requirement from the department, I'll be opening it. Okay. So I'll just go through the request types of request forms. So the request can be for the medical, and in particular medical for committee meeting. You want, for an example, you want to refer a patient or you want to put up the case for the CAN kit medical committee meeting. You have to click on medical, and from subtype of assistance you have to click on committee. And if you want to put a request for BMT, you can click here under medical. You can click on BMT, and when I click on save, so this patient will be referred to medical department for BMT as a BMT request. Okay, so this is how the concept of request form goes. So you can refer to a particular department or for a particular service, right? So this, when I click on save, this means this person, let me write down my name. So this person has, by default, it should be CHSU, and it should be today or the date you have made that request. I want this patient to be provide conveyance from one state to another. I have listed down the date, and on which date I want this request to be effective, which means I want this patient to be traveling on 1st November. I can write here. All right. And I can, in remarks, I can explain from where to where. And when I click on save, the person responsible for conveyance and outstation will have access to a report. He will see all the lists of requests he is getting for all the patients, and he will see for the 1st November he has request for this patient. Clear so far? And for NHH, this means that this patient needs admission, this family needs admission, and the total family members are 3 who will be staying. And on 1st November, they want admission for this HAH. All right. So this is how the request form goes, and you can generate referrals and request form for different departments for different services. So this is the person who is responsible for generating that request. This person will be contacted regarding any details about the request. Okay. By default, it will remain open, and it will be closed only when the assistance was provided or was not provided. Okay. So this was the request form. Any question related to the request form?
No, sir.
Okay. I'll just move on to the provided form. So this is quite a similar form. It's just named as provided. this means that assistance was given to the patient without the request, or maybe with the request, not necessarily with or without any request form. So this can be entered multiple times. Whenever there is any intervention, you will be entering it multiple times for different types of assistance. You cannot create one provide. You cannot fill one provide form for different interventions. If you have provided drug and diagnostic for a patient on the same day, you have to enter drug details on one form. You have to click save, and for diagnostic you have to enter you have to click on save and create a new provided form. All right, clear? So for medical, these are the list of all the interventions which can be provided to the patient. This basically means that this patient has got MRD in the hospital, for the hospital social worker on this date. You need not enter each and every detail, but there are some fields which are important. And if you know who is the vendor you have got that MRD from, you can write that Dabur or whatever. So that vendor has to have registered with the CAN kits or with medical department or with vCAN. When the details come of the bill comes, so medical department is the responsible department to enter the bill number and the amount. When you have provided diagnostic, you have sanctioned that this patient will be sent for diagnostic purpose, you have to enter this form on that day only. You need not wait for the bill. The bill details will be entered by the medical department whenever the bill comes. That's why we have created a limitation on this field. You cannot enter this field after 30 days. If I click here for 6 months, this form will not be accepted because it's older assistance date. This assistance date is older than 30 days. This form cannot be saved. For such scenarios, you have to write to the group or in the group, or write to me by email, CCing your manager why it was delayed, why the entry was delayed. Medical department is responsible for entering the bill. All the social workers, all the department dietitians are responsible for entering all the assistance which is being given to the patient. All right. Let me go to the different type of assistance, which is, for example, HH admission. In HH, there is a special field called assistance end date. So this is also available on the request date. This means that this patient was provided assistance or the provided admission, HH admission on June 10th, and was discharged from HH on this date. How many people stayed in, including the patient? 4 maybe. Amount need not to be entered. Bill number need not to be entered. You can write here any remarks you want to. If any problem you might have faced regarding that stay, or the supervisor. This is only filled by the supervisor actually, and they can write any in the remark field. This is an open field. Any issue or any detail they want to write. So this is for their own reference.
अंकित,
Yes.
अंकित सॉरी यार मैं डिस्टर्ब कर रहा हूँ, बट दिल्ली के जितने भी सोशल वर्कर्स हैं, प्लीज आपकी एमसीएम अब स्टार्ट हो रही है, तो प्लीज ज्वाइन कर लीजिए. आप ये मीटिंग छोड़ के जा सकते हो. प्रताप, ओम प्रकाश एंड ऑल जितने भी हैं दिल्ली के, ठीक है.
अंकित सर, एक बार डेली वीकेंड एंड डायरी एंट्री के बारे में बता देते शॉर्ट में हुए थे, जब भी स्टार्ट होने वाली सर एमसीएम.
So डायरी आई थिंक इम्पोर्टेंट पार्ट है, इसको मैं बता ही देता हूँ.
हाँ सर, फिर हम ज्वाइन कर लेंगे सर एमसीएम, उसी के लिए सर.
ठीक है. मैं जल्दी से बता देता हूँ. जैसे आपको डेली डायरी के लिए यहाँ पे आप मोबाइल से भी वैसे कर सकते हैं. आपको सर्च करना है अपना नाम, ठीक है. जैसे सहवाज का मैंने सोशल वर्कर का खोला हुआ है, सॉरी शहबाज का मुझे सीके रैप वाला खोलना है, ठीक है। ये रहा सीके रैप का, सबसे ऊपर आएगा वैसे बाय डिफॉल्ट। सीके रैप के जो फॉर्म है उसमें जनरल रिपोर्ट का एक सेक्शन है, इसमें यहाँ पे न्यू का एक बटन है, ठीक है। बहुत सिंपल फॉर्म है, इसमें सिर्फ एक ओपन फील्ड है। इन दिस फॉर्म you have to enter any activity which you have done today, right? For an example, if it's not today, a donor visited a hospital at 11 a.m., right? And you can link the hospital name, because it will not be linked by itself. You have to mention your hospital here. So when you click on save, I will not be clicking on save, maybe I should. Okay, fine, I'll delete it later. When I click save, this will be linked to Shehbaz's daily diary. So this is like a daily diary. On this date, Shehbaz has made an entry that the donor visited this hospital, and this will be reflected as well on that hospital general reports. Here, see, this is the hospital form, hospital page, and in this general report, this is also reflected that donor visited, and we can check who has made that entry on which date. If you have missed that entry, you have not entered it on the same day, you can write in the remarks field itself that the donor visited on 1st of October. And you can click on save, and this would mean that although you have made entry on 10th October, but the donor visited on 1st October, and in that hospital general report, there is a report available where we can see on which date what events were happening. That was all for daily diary. I can also show it on phone, how it happens on phone. But
सर हमें ये डेली मेंटेन करना है या कुछ स्पेशली इवेंट्स पे सर मेंटेन करना है सर?
You have to enter it daily.
Okay.
What activities you have done in that for that day.
Okay.
Ankit, sorry, but
Yes.
I have to leave this meeting because there's another meeting is scheduled for today. If you may excuse me for today's meeting.
Sure, of course.
Yeah.
I'll be also finishing it up. I'll be just explaining the assistance form, and I'll be covering everything else on our next session next week.
Okay. Thank you, Ankit. Thank you. And I have also many of the questions which I'll definitely share with you later on.
Sure.
Thank you so much. Thank you, everyone.
Okay.
Have a great day ahead. Bye-bye.
Bye-bye.
Okay.
Okay, sir. Thank you.
Okay, so all the daily social workers can leave. I'll be just finishing up with the assistance form, and I'll be covering other topics on the next session.
अंकित सर,
हाँ जी,
वाडिया हॉस्पिटल से बोल रहा हूँ, बालकृष्ण।
हाँ जी,
हाँ सर, ये लास्ट टाइम मैंने कॉल भी किया था, एक फैसिलिटेशन रिपोर्ट के बारे में थोड़ा गलत आ रहा है सेल्सफोर्स से ना हमारा, तो उसके लिए क्या आपसे कॉल पे बात कर लूँ बाद में, ये सेशन के लिए आप भी बता दीजिए।
नहीं, आई थिंक वो अलग से करते हैं उसको।
हाँ, रिपोर्ट का जब भी आप टॉपिक लोगे तभी वो,
हाँ, वो नेक्स्ट वीक करने का अब हो गया, मैं जल्दी करूंगा, मे बी ट्यूसडे वेडनेसडे को सोच रहा हूँ।
अभी के लिए सर 6 महीने का मेरा एक थोड़ा अटका है, तो मैं इसके बाद कॉल कर लूँ सर आपको?
हाँ ठीक है,
ठीक है, ठीक है। Thank you, sir. Continue.
Okay. Let me get back to the assistance part. All right. So this is the assistance one of the example. No. Open another PSP education. Okay. So this is one of the example for which is made for the conveyance from a local conveyance which was provided to a patient to Apollo Hospital by Pratap Singh. I cannot edit it, right? But for the same CK ID, I can create any new assistance. I think the concept between the request form and the provided form is quite clear. There are different type of assistance available for each and every department. I will not be going in detail of each and every service or each and every intervention. You can get explanation from the department itself in their orientation or in their PPT. If you have any specific question related to any intervention, you can ask. Otherwise, I'll be skipping and I'll be moving on to the next step. So basically, this means if this assistance was provided in an HH, you can also write in HH on which date and the person responsible who has provided this assistance. Okay, and when we click on save, that record will reflect on this CKID related page, and we will have a summary of all the interventions given to a patient on this page itself. Right. Any questions related to assistance form so far?
नो सर,
Okay.
कोई क्वेश्चन सर। ये एक्चुअली मुझे सर ने भी बताया था ना, नसीम सर ने भी, तो इसीलिए मैंने खुद भी किया था ये उनके लैपटॉप पे कि एडमिशन्स कैसे होती है, ये फॉर्म सारे फिल किए थे तीनों बच्चों के जो भी पेशेंट्स थे ना। हाँ जी।
I think in the end, I'll just go to the reports and I'll just show what templates are available. Okay, I think that would be much. This is the most important part of whole process, because people might be entering, different people might be entering patient register form, different people might be entering patient register, or sorry, assistance and everything, but the final, the most of the important parts which you should get correctly should in the report section. In the report section, the hospitals which you are responsible for, which you have access, should have access to, will be reflected in all folders. For example, Shehbaz has access to GTB, MANC, RML, and SSPH hospitals. So he can see all these hospitals here. Other than Shehbaz, there might be some other social workers who are using the Shehbaz login ID, and they are responsible for their hospitals. That's why these hospitals are reflected on Shehbaz Salesforce ID. Okay, I'll just open GTP as an example. So in the all folders, when I click here, GTB, I can see all the GTB related files. When I click on report section, I can only see the most recently opened reports. I will not be able to see all the reports. If I want to see all the reports which are accessible to me, I have to click on all reports, but that will be quite a list, because that will also include the public reports also. It will become quite confusing. If I know the name of the report, I can click and search here. Right. I will not be going in detail of each and every report, but I'll be only covering all the important reports available. For each and every hospital, the most important 2-3 reports are the baseline report. I'll open in the next tab for you to see. The next important report is the assistance metrics. I'll open in next tab for you to see. And as Aniket was asking for facilitation, who was asking for the facilitation report?
हाँ sir.
So I'll be opening the facilitation report for the hospital for you to see. Okay. All right. I'll start with the baseline. So this is the basic detail of a patient who is getting registered, right? I can sort it from any of these fields. I can sort it from the type of cancer or subtype of cancer. Like sorting can be done and a grouping can be done. Right. For an example, I want to see only the males and females of this hospital. I can group it from this field. And the grouping will be available. 4 females and 9 males are registered in this time period. So I'm not sure which time period I'm looking at. I can look at the time period by clicking here on filters. In filters, I can see that I am seeing the list of patients who are registered in current financial year from 1st April till today or whatever date. I can also change this to previous financial year by changing from here, and there are lists of drop downs available by default, and I can also customize it and pick a date for myself. For example, I want to see a list of patients from 10th of 2019 till 10th of 2020. Right. So this is the list of the patient. All right, and I can click here on detail row section, and I can see a summary, tabular format of summary of these patients by male and female. So I can see there is one patient who doesn't have a gender specified for this. I can click on detail row and see the name of that patient. I can see the cancer is also other, the phone number is also not mentioned, and there are quite few details which are not mentioned for this patient. I can click on the name itself. I can single left click on it and can also right click and open in next tab. So this is an incomplete actually form for a patient. It's quite an old form, and this is actually belong to a donor which is incorrectly entered as a patient with a CKID. So there might be some changes which might have done for this. So that's why this has been converted to donor, but it belongs to a patient. Okay. I'll just skip it for now. All right. So these are some details which are available for a patient for you to see easily on the baseline. If you want to add any field or remove any field which you do not want to see, for example, you do not want to see the treatment doctor name, you can remove it. And this form will become easier and simpler for you to see. Maybe remark column is creating a problem, I can remove it, and you will have less columns for you to see. Right. I do not want to no longer see this grouping. I can make it back in the detail. I want to see how many of patients in this time period are alive. I can group them. I can also group another level, second level of grouping, which is I want to make it in the group. So I can see there are 32 patients alive, and from 31 are on treatment. Well, that's mostly because leukemia treatment goes on till 2.5 years. I can make another level of grouping, and I can see from 31 on treatment patient, 26 are ALL. So these are some of the functions which you can do very quite easily on the baseline. But be mindful that you cannot do or customize these reports based on the assistance, because this is a baseline report, and assistance report, anything which is related to assistance is not quite available on the baseline. Okay. For assistance baseline, there is a separate report which is called assistance matrix. You can do quite a few functions and use quite a few features here. All right, so this is giving me a summary of all the assistance which was provided in a particular time period, which is current financial year. So I can see from this report drugs was provided to 26 patients in the current financial year for this patient. Okay, so there is another filter entered for this patient in which the facilitation is being censored. I will not go there, but I can see 51 patients in current financial year. Oh, there is a mistake here. I'll have to correct it. In the filter, they should be, record type should be provided. That was missing in this report. Sometimes I do find some mistakes and I try to correct them. And I'll click on save and run. So next time when I'll open this report, I will see the correct report. When I click on run report, if I don't click on save, next time if I open the report, I will see the default version. I will not see this version of the report if I don't click on save. If you want to, every time you open the report and if you want to see the same column which you have customized, you have to click on save as or save. Otherwise, it will be opening in the same format which was saved earlier. I'll just showing you as an example. The same format which was already saved, the last version which was saved there. Okay. So 49 patients in GTB hospital received any type of assistance from CAN Kids, and that include 15 lakh support for drug diagnostic.
अंकित सर,
Yes.
अंकित सर, ये 49 पेशेंट्स हैं या नंबर ऑफ स्पॉट है?
So if you can see the top right, so there is a sum of unique contacts. Unique contact means number of patients. Okay, so 49 is the unique contacts, and when I see record count, so this means episodes of assistance. So 15 patients has got any type of diagnostic support in current financial year, but 15 patients have got 31 times any diagnostic support. So the record count is 31. The amount which he has spent is 52,000, and the number of patients who have received that diagnostic or that intervention is 15. Clear?
Okay, yes, sir.
All right. I can change date, and I can also do quite a few things, customize it. But I think I'll not do it. I'll just move on to the facilitation part. So GTB doesn't have any facilitation. Can you give me an example which hospital I want to see the facilitation for? Give me a hospital name. Give me a hospital name for which I want to see the facilitation.
सर इस साल तो मेरा हुआ नहीं.
अंकित सर मैक्स का देख लो आप.
मैक्स का फैसिलिटेशन देखूं?
हाँ जी, हाँ जी.
ओके. I'll just change this for previous financial year. Okay, so I'll click here. I'm clicking on detail row to hide the names of the patient or the funds, but this is the list of the patient who has received facilitation. Okay, so the number is 27. The amount they have received facilitation is for 72 lakh. Okay, and in April this patient has received facilitation. In May this patient has received facilitation. Okay, I can see the name of all the facilitation or the type of fund they have got from this, by clicking on detail row. Right? From PM fund, from this fund, each and every fund I can see. Maybe I can do this also, but this is not actually the correct way to do that, but I have updated this. I'll be showing it now based on new field. This is based on the older fields. For BMT, for CM fund, how many patients have got received for CM fund, I can list them out. All right. So there has been an update on facilitation. I'll be creating a new report. I haven't created so far. That's why I've given the time to Aniket for different call. I'll be making this for facilitation. Sorry.
अंकित सर, इसमें हमारे जो एमसीएम में अप्रूवल होता है तो वो भी शो करना चाहिए फैसिलिटेशन में?
क्या शो करना चाहिए?
जो एमसीएम में हमें अप्रूवल मिलता है।
एमसीएम में क्या मिलता है? वो अप्रूवल मिलता है? नहीं, वो फैसिलिटेशन नहीं है, वो कैनकिस का सैंक्शन है।
सैंक्शन में आएगा, फिर अलग से आएगा?
वो कैनकिस का सैंक्शन में आएगा। मैं अभी एक एग्जांपल के लिए दिखा रहा हूँ फैसिलिटेशन का।
अंकित सर।
हाँ जी।
हाँ, वो पहले क्या होता था सर, मेडिकल में फैसिलिटेशन था ना, और अभी फैसिलिटेशन डायरेक्ट ये हो गया।
हाँ
हाँ, तो जो निकालते हैं ना हम लोग मंथ वाइज जब भी उसका, तो अभी जून के इसमें वो अलग अलग दिखाता है। तो
मुझे उसके लिए एक अलग रिपोर्ट बनानी पड़ेगी, वो मैंने अभी तक बनाई नहीं है। मैं वही बनाने की कोशिश कर रहा था, लेकिन आई थिंक
मैंने अलग अलग निकाल चेक किया ना सर, तो फिगर मिसमैच होते हैं।
हाँ नहीं, मैं आई अंडरस्टैंड प्रॉब्लम क्या है। जब हम एक अलग से कॉल करेंगे, मैं सब हॉस्पिटल के लिए ना एक एक रिपोर्ट डाल दूंगा सब में, जो नई जो करेक्ट रिपोर्ट दिखाएगी करंट फाइनेंशियल ईयर के लिए। ठीक है, आई डू दैट।
ओके। और सर अभी मतलब ये 6 महीने के रिपोर्ट में ना हम लोग ने वो पहले वाला फैसिलिटेशन के हिसाब से मैंने रिपोर्ट निकाला, उसका फिगर और नए वाले फैसिलिटेशन का फिगर ऐड किया ना, तो भी फिगर बाद में महीने वाइज निकालते हैं ना, तो मिसमैच होता है सर।
हाँ नहीं, वो ठीक कर दूंगा मैं, वो हो जाएगा ठीक।
हो जाएगा।
आई नो देयर इज अ प्रॉब्लम, बट आई विल फिक्स इट।
ओके ओके
ओके, आई थिंक सेशन आज का यही खत्म करते हैं। Otherwise, there would be too much information and people will getting bored. So we can continue the session, the agenda which has been left to for maybe Wednesday. I'll try for Wednesday. I'll find time on Wednesday. There might be. I'll fix up time with Balbir and Punjab team.
अंकित जी।
हाँ संजय बताइए।
सेशन कोई 11 बजे के बाद नहीं हो सकता? एक्चुअली मेरा पेट ऑनको हिमेटो का क्लिनिक होता है, मैं ज्वाइन नहीं कर पाता। तो ये 12 बजे के बाद अगर हो जाए, 12:30 बजे।
मैं कोशिश करूंगा संजय, बट आई कांट प्रॉमिस बिकॉज आई हैव टू फिक्स टाइम विद पंजाब टीम। आई हैव टू चेक देयर अवेलेबिलिटी एट फर्स्ट। दिस सेशन इज फॉर न्यू ज्वाइनीज। आई विल बी मेकिंग, मैं इसको यूट्यूब पे डाल दूंगा ताकि आप कभी भी इसको देख पाए। But I have to take priority from Punjab team.
Fine.
ठीक है?
ठीक है।
Ankit, thank you very much. It was a very good session. We learned a lot from you, but still we need your help in future also.
Sorry, I didn't get you. What are you saying?
Hello.
Thank you.
हाँ बलबीर जी बताइए।
हाँ जी अंकित जी, इट वाज अ नाइस सेशन। बहुत अच्छा सेशन था, हमें तो बहुत अच्छा लगा ये, बट वी नीड योर हेल्प इन फ्यूचर। अभी तो हमने स्टार्ट नहीं किया है।
अच्छा
तो
ठीक है।
a lot of queries and questions will come out. Definitely, we will have a talk with you later.
Sure, I am. Actually, when we start working there, you will face more problems, and of course, I am ready for any query, any questions, because people when they start working and the people who are working and who are working in detail will only face the problem.
Definitely.
And definitely once we get on the laptop for filling the information, probably that time would we really require the assistance more.
Sure. So that's why we have also created that vCAN help desk group. So that group, not only if I am not available, somebody from the group can also help and answer your queries.
Great, sir.
Ankit ji, username and password के लिए we need username and password also. So that will be provided by you or we have to create?
I'll check that out. For you, I think there is a separate ID, but let me check.
Yeah, please.
Okay. All right. Thank you all for joining. There are lots of other important information left out. Please join in next session.
Thank you, sir.
All right.
Thank you, sir.
सर YouTube पे शेयर कर देना अभी.
आज का सेशन मैं YouTube पे डाल दूंगा.
Yeah, so that anything that we might have missed, we can come back with that. Right. Thank you.
Hello.